All right, so welcome again.
Welcome.
Welcome to the channel. So today we are going to be talking about something that has a tendency to be a bit controversial, but we are not a controversial channel. We are, but
We just bringing to light what you're probably thinking about.
we are down to earth and we are very fair. I always talk about fairness and objectivity in everything that we discuss. I don't think there's any other channel that is as objective as we are. Prove me wrong. I always say we may not have that so many subscribers. Of course, you can make that change.
Yeah, change that narrative.
Maybe not so many views, but just watch the videos. Because I remember there was this video we made on money rituals. There's no other video like it on the internet.
Yeah.
So I mean, check out that video. You understand what?
Highly cerebral videos. You know, what are you waiting for? Really?
Right. So the whole country has been talking about our past president who died in London.
London.
Yeah.
London.
And I've seen different perspectives. You know, people saying different things. You know, sometimes people talk out of emotions. It's not necessarily correct. Right? So we're going to be talking about the medical side of the death of our president. Of course, we know he died in the hospital, so that's medical enough. But what are the things that we actually need to take note of as regards the death of our president? So we are not going to be talking about
death of our ex-president.
Yeah, ex-president. But once you are a president, you are always called president. So when they are saying calling his name, they don't say ex-president this, they just say president this.
All right.
So once a president, forever a
president. Okay.
Right. Now, we're not going to be talking about whether he rigged an election or whether, no, we're not discussing all that. He died in a London hospital. Many people have a challenge with the fact that he died in a London hospital.
London. Maybe I should speak British English. Oh, yeah.
Yeah, so is there anything special about him dying in a London hospital? I'm not too sure there's anything special, okay?
Wow. So, well...
Now, let's discuss the first thing that many people talk about. They say hospitals in Nigeria, these leaders have not built hospitals in Nigeria, and then the first thing they do is to travel out of the country. Yes, I totally agree with that. I mean, that is wrong. You don't upgrade the medical facilities in your own country and then you go to another country to experience or to gain access to those same facilities.
High-class medical care.
High-class medical care.
Sophisticated medical care. Let's say those countries didn't develop themselves to that level.
Yeah.
Are they going to have access to that kind of thing? Kind of a thing? And it looks to me like if you have to go elsewhere to access care, then there are so many reasons though, but the first thing that pops up in your mind is could it be that there's lack of confidence in the competence of the medical personnel, the equipment, maybe they are not well equipped, no lack of confidence in whatever way you want to think about it.
Yeah, and that is what most Nigerians talk about, and that is completely correct. However, on this channel, we go beyond the surface. Now, let's go a bit deeper.
Okay.
It wouldn't have been a problem if the facilities in Nigeria were at a super level. I mean, you upgrade the facilities, medical facilities in your own country, but you feel that for personal reasons, you want to go to another country. Nobody's going to complain. I mean, if we had top level medical treatment in Nigeria, which I think we have, which we'll also come to shortly, but we're talking generally about, you know,
the common thing, the pervading thing. If we're going to talk about healthcare in Nigeria, what pops up in your mind? There are a few sophisticated ones that are not even accessible to the common Nigerian. Even myself as a medical doctor, there are places I cannot go to access care. So that's what we're talking about, not the few high class that we know have the capacity to provide care that London or any other country
so we are going
to
come back to that. So let's just stay on the point that the challenge we have here is that our general hospitals, our tertiary facilities, the government hospitals,
let's start from the primary health care.
They are in a very bad state.
Primary health care, fundamental to any form of care, they are in a very bad state.
So if they are in a very bad state, then everybody is going to
but
say,
we must give it to Lagos State, at least Lagos State.
Yeah. I mean, that's when you are comparing them with others.
Others, but at least they are trying
to some extent.
So
if we had upgraded our medical facilities, our government medical facilities, to a very good level, I don't think it would be wrong for us to complain that it travels to London. I mean, that's its own choice.
Yeah, it will be a matter of choice.
It will be a matter of choice. Somebody will say, why doesn't the Queen of England travel out of their own country? Yes, you have a very good point. You have a very good point. However,
or the president of the US.
Or president of the US, why doesn't he seek care outside of the US? Yes, so that's where it's a bit, tricky. That's where I may agree with you, because generally speaking, even if your medical facilities are the best, there's a sense of belonging, a sense of patriotism that makes you to seek patriotism. Yes, patriotism. Yeah, that makes you to seek care in your own country. Yeah. It's almost like I want to buy a shirt. I know that if good shirts are produced in my country, so if I'm patriotic, I want to buy the shirt from my country. So the same way, people expect that their leaders should seek medical care in their own country. As a sense of patriotism.
Leadership is by example.
Yes, it is by example. That's a way of you saying, I'm confident in our healthcare system. Right? So you seeking healthcare in your own country is a way of you saying, yes, I'm confident in what I've built. So that is correct. That is correct. So that's why at the end of the day,
confidence in what they've built.
So at the end of the day, I still think that people who demand that they seek care in Nigeria are correct. Right? But the other thing I just want us to note is that if and only if our healthcare system was beautiful, excellent, would not have had too much of a problem with him traveling to London.
So actually, it would have been a matter of it was just his choice. Anyway, seeing we have good and quality healthcare here, it was just his choice.
In several years ago, we know that many other leaders in other countries in the Commonwealth used to come to the University College in Ibadan, now known as the University College Hospital in Ibadan, for medical care. So people will come from other countries to seek care here, all right, because the level of expertise, personnel, equipment, everything was top notch. Right? So, but those days, we pray for those days again.
God have mercy.
So I think that's the first point. The spokesman to the former president even went on air to say if the president was being managed in Nigeria, he would have died long ago.
God have mercy.
That's the height of it. I mean, why would somebody come out and say that kind of thing?
So absolutely. So what he said has just buttressed the fact that there's no confidence in the personnel and whatever it is that they have built.
Now let's go to another point, which is important.
But before we go to another point, even with the current state of our healthcare system, so basically we're talking about medical tourism. It's both ways. Do you know that? I'm sure you do know, because you've operated people like that, come from the abroad to come and get operated in Nigeria. And I'm sure he has operated some celebrities who came from abroad to Nigeria to get their operations done because it's cheaper for them. And so it's this confidence you are talking about is relative. It's relative. Some people do appreciate us, even if our own don't appreciate us.
Yes, so as a matter of fact, that was where I was coming to. The fact that sometimes your perspective and perception matters. If you think medical care in Nigeria is so bad that you have to travel out of the country, you are totally wrong.
That's
The level of expertise you can get in this country, I can tell you, sometimes that's the best you can get in some other countries. I can tell you for sure, but you will not believe. And the reason why you may not find it easy to believe is that level of care in Nigeria is probably very expensive, and you don't readily see it around. So,
even if you have it, even if they are working amongst you, such people in terms of personnel now, if they are working amongst you in the same church, in the same place, the same this, you don't see it.
You don't see it now. You just
because
see
this regular person. They commonize it.
What can he do?
They commonize it, you know.
Now, let's do it like this. The hospital he went to, the London clinic, where does it rank? In London, where does it rank in London among hospitals? It ranks number 53.
Wow.
So what are we saying? You rank number 53 in London, and then you are saying, so it's not like, I mean, yes, it's a big private hospital, very old. I mean, I think the hospital is about 92 years old.
Wow.
Right. So it's a good hospital. If you check the videos of the hospital, you see that it's more or less like a hotel. You know, the way they welcome you, the way the environment looks very calm, serene. They accompany you, do everything like that. That's probably what they are going for, just for that comfort. And I think the other thing they go for is maybe some privacy. Just want everything to be kept secret.
I raised the issue of confidentiality. The truth is, if he had assessed care in Nigeria, his privacy, I won't guarantee the privacy, you know, guarantee the privacy totally. Somehow, whatever he was treating might have leaked out. But today, even till today, there are just speculations going around. We don't know, we didn't have an idea of what the condition he managed was.
So I agree with you that we may have some challenges with confidentiality, but I don't also think that's correct. Because one, look at it in two ways. One is the fact that the medical diagnosis, treatments of our leaders are not supposed to be kept secret. They are supposed to be able to tell us, even though they are not, confidentiality here doesn't mean you are going to tell us the details of everything wrong with the person, that the person has HIV, has this, no, or has TB. No, you have to just let us know that the person is being treated for a disease. You know, even recently, President Biden, he came out with his diagnosis and said, oh, this is it. So confidentiality here, which I agree with your point in a way that, you know, Nigerians are funny sometimes, but I don't think we have to look at the whole country by virtue of what some people do, where you just find somebody leaking information. It may not be so in all hospitals, where somebody goes into the hospital and then you see whatever is wrong with the person outside. I don't think it happens everywhere, because you see.
Well, that might be
let me give you an example.
That may be the fear they have.
Let me give you an example. The Obas of Ibadan. They all die in Ibadan. They've all, at least for the past few years, they've been dying in Ibadan, maybe in the University College Hospital or hospitals in Ibadan. But you don't hear people talking about their diagnosis on the social media that, oh, this was what killed this Oba. This was what killed this Oba. It doesn't mean that a few people may not know.
Yeah.
Right. So sometimes it's a figment of their imagination when they think that, oh, everybody is going to be saying this is the diagnosis on the internet. So the other thing that I also want us to talk about, which we're already going towards, is the fact that many people look at medical care. If you are not a medical person, you may not be able to say so much about the level of expertise and the level of medical care that you are experiencing or accessing. I'll give you an example. Some months ago, there was a Nigerian footballer who plays in the Premier League that had an injury while on the football pitch, and he had a blunt abdominal injury.
Okay.
He was placed in induced coma.
Okay.
They did the first surgery, they did the second surgery. What that guy had most likely was a bowel injury.
Okay.
Right? If you had a bowel injury, we have many patients who have bowel injuries in Nigeria. The patient is into theater and out of the theater.
But Nigerians are
everybody
Nigerians are tough.
No, it's not. No, the boy is tough. You cannot say an athlete is not tough. The boy is tough. He is a Nigerian boy, he's tough. The problem is not the patient. The problem is we have a way of hyping things when they happen outside Nigeria. And when they happen in Nigeria, nobody talks about it. I've had patients who come in, road traffic accidents, operate on them. 5 days after he's eating pounded yam in his house. But
people trivialize all those things. You trivialize trivialize.
But if he's in the UK, they say they
induced coma. Went for the second surgery.
If he's in Nigeria,
if you go for second, what's it power? They don't kill him.
Many times, even our leaders, when they go out to these other countries, they don't even know what the level of care they are getting. It's just the package. They are swayed by the package, and the package is not everything.
Package and name, and it applies to different things in life.
Yeah.
I'm carrying a bag. It says Prada, but there's a Nigerian brand I'm carrying that may even be better.
Yeah.
But because Prada.
Yeah.
It has name and class.
Yeah.
Sorry, scratch that. Maybe I shouldn't mention name. I'm carrying one sophisticated bag, but it's just packaging. But you see, when people see that, to buttress that your point, you may get to a hospital that they've used package to encapsulate you, and the primary care, the medical care itself is faulty.
Yeah.
So they welcome you, they greet you, they do all the hospitality. Meanwhile, it's rubbish that they are doing there. But because they've used that one to bamboozle you, yeah. I'm not saying that isn't good. Everything should go together. They care, because hospital is supposed to be a place where you offer hospitality, really. Yeah. But at the core of it is the medical care that you are going to get from that place. The hospitality is fine, but what medical care are you going to get from the place?
So I'm going to say this to counter the spokesman of the president. Maybe if he was in Nigeria, I wouldn't have died yet.
Maybe. Just
maybe.
We have very skilled doctors in Nigeria, but it's unfortunate that we are losing our own because we don't appreciate them. And
the other thing to note, which we understand, is that many times some of this care we talk about, they may not be really readily accessible to the common man. Like I think 1 or 2 months ago, there was a robotic prostatectomy done here in Lagos. How many people can afford it? But it was done here in Lagos.
Yeah.
All right. So let's not be in a hurry to mix issues. Let's not mix issues. Issues are different. This London clinic had problems. When I read about them, they were sanctioned because they had some problems with clinical governance and quality assurance and all those kind of things just a few years ago. So it doesn't mean that they are the perfect hospital. Like I said, they rank 53, so they are not the perfect hospital. So if you think that that's the perfect hospital to go, and that hospital is better than all hospitals in Nigeria in terms of expertise, in terms of, that would be wrong. Those hospitals, again, if you look at the hospital, it's not a big hospital. If you go to many hospitals, they are not big. It's a question of the quality of care they are getting there. Many of these places where people go in India, they are small hospitals, but it's the quality of care you are getting that matters. So we will still, the Aso Rock Clinic, I was reading that the Aso Rock Clinic has had a budgetary allocation of over 16 billion naira in the past 10 years. 16 billion naira. And this was the same Aso Rock Clinic where somebody was saying they don't have paracetamol, they can't treat anything. Oh, this is like an indictment on the leadership that you have spent that amount of money and you cannot receive your care. Would it be wrong for you to say there's Aso Rock Clinic there's London Clinic,
Hey!
and they are far.
Oh God.
So we don't get
God
anything
have
wrong
mercy.
about it.
God, just have mercy.
So let's always put perspective in this. But I think the summary is still that we need to do much more. We need to do much more than we are doing. I heard people saying 16 billion naira would have built hospitals like the London Clinic in 6 geopolitical zones. That's not correct. Healthcare is expensive. To build the hospital and equip it is very expensive. But it just shows that if you have spent that amount of money on just the Asoro Clinic, then we could have spent much more, and we could have seen the evidence of our spending in the lives of the common Nigerians.
Here is an appeal to our leadership. Please. Should I kneel down? Please. Can we invest in our own? We have people who are overqualified, highly qualified, but they are running away from the country because they can't even use their expertise, or their expertise is not appreciated. For a few of us that are still here, it's taking the grace of God for us to stay back. But we want to give back to our country, right? But can we provide an enabling environment for us to do so? So here is an appeal to our leadership. Please, can we build our own? Thank you.
Click the subscribe button. Bye.
Bye.